Hello, my name is Shai Smith, and I am a registered nurse at the CU Health Hospital in Denver, Colorado. And today I would like to share some helpful suggestions that I have retrieved from my experience of working with people with Alzheimer's and dementia and properly knowing how to care for them and to interact and communicate with them. So, people with Alzheimer's and dementia, they have a biological brain disorder. So the brain is deteriorating progressively over time. It is non curable and it does get worse and worse as time progresses. And many people don't know the effective ways offhand on how to properly care for them and interact with them. And today I would like to share some suggestions that can make that interaction smooth for the caring of these types of patients and even loved ones at home. And based on my experience, I have worked with assisted living companies that specialized in people with Alzheimer's and dementia. So these are some tips and tricks that I have picked up along my career path. So to get started, my first helpful suggestion is to be patient when working with people with Alzheimer's and dementia. From my own experience, I didn't have much patience. I learned to grow patience though, and patience means waiting for them to respond. Patience can mean waiting for them and allowing them to take their time when doing activities that can normally take and be done in 5 minutes. And being patient, you really need to have that trait because their brain is like a walnut with many gaps and holes in it, so it takes a lot longer of a time to respond to things and to for the thought process to actually generate, okay, what's going on. And it takes much more time than it would take for your eye to respond to the environment, to other interactions, or in a conversation. And the next helpful suggestion is to state your message clear when you're talking to them. So you don't want to use advanced vocabulary that they might not understand that can confuse them. You want to keep your words and phrases simple as possible for them so it can be easier for them to digest the information as it is already hard for them already. So by you keeping it simple and clear, that can make it way easier when you're communicating with them. This can also include keeping your tone of voice low and calm. And if they don't hear you the first time, not raising your tone of voice and just repeating it, maybe rephrasing it in a different way so they can better understand, but making sure that your message is clear is definitely helpful and as far as communicating. Another helpful trick and tip is keep it simple as far as yes or no questions. You don't want to ask several questions at once, ask one question at a time. That way they don't feel like they're getting quizzed. Don't want to ask open-ended questions that can lead to confusion. It can lead for them to have to overgenerate their brain already. So yes or no questions and keeping it simple is helpful. Give them choices of answers. For example, do you want to wear a blue or a red shirt? They have only one option to choose from. That's also a simple question that you can ask. That's another example. For the fourth helpful suggestion is to distract and redirect them. So if they're angry, you want to distract them and redirect them into a different environment, redirecting them to go somewhere else where it's more of a calm or positive environment. Also, if they're asking for a loved one who is no longer with them, you can come up with a believable answer and say, oh, yeah, they went to Safeway, or they'll be back here soon. And we just keep redirecting them. Don't ignore them, just redirect and distract them. And then for the final helpful suggestion is to be a helping hand. So, like I said, these people have a deteriorating brain, so it will take them much longer to do tasks. And the reason behind that is because they forgot how to do them. For example, do like brushing your teeth or tying a shoe. They may not remember how to properly tie a shoe. I remember working with a resident who smoked. She didn't remember how to even light her lighter. So helping them out, giving them a guide, a helpful hand, intervening if we see them struggling can definitely help and make things smoother. If they're struggling and no one is helping, that can make them frustrated and lead to even more problems. And they don't even remember their loved ones or who they are or where they are. So it's not surprising that they don't remember sometimes how to do simple daily tasks. So, to reiterate, 5 helpful suggestions is to remain calm, state your message clear, ask simple yes or no questions, distract and redirect in tough situations, and to be a helping hand are all suggestions that I suggest for interacting with patients and loved ones with Alzheimer's and dementia. From my experience, these were top 5 of my favorites that definitely worked for me in creating a smoother, calmer, and positive environment for them. And I hope that these helpful suggestions can also help you with your interactions with patients of Alzheimer's and dementia as well. Thank you.